Welcome back to today's episode of Nurse Notes, where we break down complex clinical concepts into simple, clear conversations. And today we're diving into a very common but often confusing topic: IV fluids. Specifically, normal saline versus Ringer's lactate. What's the difference, and when do we use one over the other? First, let's talk about normal saline, also known as 0.9% sodium chloride. It's basically sterile water with salt in the same concentration as our blood plasma. That makes it isotonic, meaning it won't cause cells to shrink or swell. NS is the most commonly used fluid in hospitals. It's the go-to for dehydration, shock, and fluid resuscitation. But here's the catch: it has a higher chloride content than our body naturally does. So, large volumes can lead to something called hyperchloremic metabolic acidosis. Hyperchloremic metabolic acidosis can appear after big resuscitations with NS. So monitor electrolytes and acid-base status if you're giving large volumes. NS is simple and reliable, but not always the most balanced choice. Let's compare that to Ringer's lactate. Often just called RL. RL is also isotonic, but it's a more balanced solution. It contains sodium, chloride, potassium, calcium, and lactate. The lactate in RL isn't for nutrition. It actually gets converted by the liver into bicarbonate, which helps buffer acid in the body. So RL is especially useful in cases like burns, trauma, or sepsis, where acidosis might be an issue. RL's balanced electrolytes help when patients have large losses or are acidotic. Use RL for burns, trauma, and many sepsis protocols where buffering helps. One important note: RL contains calcium, so you don't give it with blood transfusions. Normal saline is safer there. So, which one do we pick? Here's a quick cheat sheet. NS, good for head injuries, hyponatremia, and when you want to avoid potassium or calcium. RL, better in cases of metabolic acidosis, trauma, or major blood loss, since it's more physiologically balanced. Remember, both are clear, both save lives. Choose based on physiology and context. And again, because RL has calcium, don't run it with blood transfusions. NS is safer. So the next time you see those two clear bags hanging in the ward, remember they may look the same, but they're tailored for different needs. NS is like your simple saltwater fix, while RL is more like a balanced electrolyte cocktail. Both save lives when used right. That's it for today's episode. If you found this useful, don't forget to share it with a fellow nurse, med student, or anyone curious. Until next time, stay curious, stay compassionate, and keep learning.